While we are talking about the different behavioral disorders or the different disorders that can result in the abnormality of the conduct of the child, we've already gone through one of the disorders, which is known as the attention deficit hyperactivity syndrome, which can result in the abnormal behavior or abnormal conduct of the child, and aggressive behavior is usually seen in these children. So that is the highlight over there, that the conduct of the overall conduct of the child would be an aggressive child. Over here, we are discussing an other section, which is the autistic spectrum disorder. So it's basically a spectral disorder. One child who is suffering from an autism will differ from another child who is suffering from the same disorder. So it's not a uniformity that is observed in these children, in these patients. There is a range of symptoms that is seen. Sometimes the children would suffer from a specific kind of a learning disability, and sometimes they would not suffer. The IQ would be even normal, but still they would be considered to be put or categorized in this autistic spectral kind of disorders. So dealing with these children again is very important over here. A lot of awareness campaigns have been carried out to make the people more aware of this condition. To diagnose this condition at an early stage is the ultimate goal that is to be achieved right now, because an early diagnosis is going to result in a better outcome. So getting the children and getting the general public aware of this condition, which is known as autism in the layman terminology, or autistic spectrum disorder, again is very important over here. A lot of work, a lot of research has been carried out to get to know about the cause of these kind of disorders, but to no avail. Basically, the etiology is quite non-specific in these kind of disorders. But still, we have to go through the clinical symptomatology, the clinical features that is encompassing this kind of a spectral disorder, and that is going to highlight the relevant causes or the risk factors that can result in this autistic spectrum disorder over here. So in this section, primarily, we'll be discussing the definition, and along with that, one should know what are the risk factors to the development of this autistic spectrum disorder, the clinical features that are usually seen in this kind of disorder, and then finally, the assessment, whether the person is suffering from a milder form, the moderate form of the disease, or the severe form of the disease is again very important. And then finally, the management of such patients, what are the guidelines for such a treatment, for such patients is again very important and significant to learn. Defining this condition, the developmental neurological condition that is characterized by the delays in the social interaction and then the delays in the development of expressive and receptive language. So this is basically the triad of the symptomatology that is seen in this kind of an autistic spectral disorder. There are restrictive interests. For example, the child would usually give a history of an interest in the dinosaurs, or more of the interest or more of the inclination towards the computers. So usually the IQ of the child would be average, above average, depending upon the severity of the disease, or even it can be below average if it is a severely deformed individual. The social interaction would be quite limited in these cases, and the expressions and then the receptive languages are also going to be affected in these cases of the autistic children or the autisms. There's going to be a repetitive or stereotypical behavior. For example, the rocking and the hand flapping, pacing, or echolalia. Echolalia is basically when there is a repetition of a particular phrase in the speech of a person. So that is going to be known as the echolalia. They may have difficulty with the acquisition of motor skills, depending upon the severity. If it is a severe form of a disease, then the person can be immobile even. Autism and Asperger's syndrome. So Asperger's syndrome is basically a kind of an autism, or one of the autistic spectral disorders, which is basically a milder form of the disease. Usually the people who are suffering from Asperger's syndrome have a normal IQ. They're not quite unsocial, and they lead quite a normal life, but they still have some difficulties in trusting people, and they have that particular repetitive behavior seen as well. So these people will have all those symptoms in a lighter or a milder form. Those with Asperger's have average or even above average intelligence, but still they do not fit in. So that fitting in problem is going to be seen in these individuals, particularly suffering from Asperger's syndrome. They're more common in boys. So this is one of the epidemiological factor that is seen, that it is more prevalent in this male gender rather than in the female gender. The risk factors included are they can be genetic, then the children with learning disabilities, and the onset is before 3 years of age. No clear evidence to link with measles, mumps, rubella, which is basically a triple vaccine. So usually the clinical features that are seen in this autistic spectrum disorder, they can be the behavioral programs that are usually designed for such children who are suffering from autism. Educational and learning programs are also designed for these children. Other treatments and therapies are also given to these children, and then medication. So these are basically the treatment guidelines that can be given to the people or the children who are suffering from the autism. The particular clinical features that are seen in such autistic children are the impairment of the social interaction, the impairment of the communication. The children are usually going to suffer from the unsocializing behavior or the phenomena. There is going to be a restricted, repetitive, stereotyped behavior. Interests and activities are also going to be limited at most in these children. There is going to be a triad of impairment that is going to be seen in these children. The conduct and overall behavior of these children, they are going to be unsocial, the interests are going to be limited, the language or the motor skills are also going to be affected in these children. Supportive therapies are usually offered for these children just to get them out of that particular situation that they are suffering from. Helping the child perspective to be understood. So one should, while one is managing such cases of autism, one should know how to get the child's perspective about his or her disease. Getting him or her an insight about their own disease is again very important over here. Management guidelines would usually indicate helping the family to understand the young person and getting them aware of the condition is very important. Educational settings and behavioral strategies are usually designed to get the child out of that particular condition, to make him more fruitful or more helpful to the society, to the community, and to himself or herself as well. So these are the goals while you're treating the children who are suffering from autistic spectral disorders. A thorough history and assessment to assess the severity of the disease is again very important, because that severity is basically going to affect the outcomes of the treatment and the management. Cognitive behavioral therapy is usually put forth when you're treating these patients with autistic spectral disorders. So in this section, basically, we focused on another psychiatric illness that is commonly seen in children, which is known as the autistic spectral disorders, which is a range of disorders, and one should know how to diagnose and go about and treat these cases. So that is the end of this section. Thank you for watching sqadia.com.